Welcome back to Practice Underwater. We are back with part two of our Practice Underwater with Tom, and Tom is our dentist up north. And Tom has it was if you listen to part one, this one was amusing. I ended it with this idea that no two are the same, Practice Underwaters, and I really feel that very strongly. I think I haven't found myself. Normally, I'm not very conflicted. Normally, I ask a lot of questions at the beginning. That's what I love about being anonymous. I can just ask questions. And, Tom bought a practice, was doing about 1.1 million about 5 years ago. It's grown the practice about 1.65, good, healthy take home. And, Tom is in the middle of paying off student loan debt. Tom's clinical mix is primarily bread and butter, doesn't do a lot of implants, does some endo and extractions, healthy new patient flow. And, kind of the core issues were that, Tom was working 8 to 6, four tens, and also Friday 8 to 2. And, that was not necessarily in line with how Tom wants to live his life. And so, I think that was definitely one thing. And then the other thing is I think Tom has a desire for a group practice, but doesn't know where that fits in. And so, I found myself really just kind of grappling with these different things that were at odds. And I think that from my standpoint, the thing I really wanted to convey to Tom is that, we need to build the practice around your life, right? Your life needs to be the driver behind how we make decisions at the office. And, that's where I think we kind of left with our goals, which is, we want to do well financially, of course, but we also want to work Monday through Thursday, 8 to 4, and, have the kind of the schedule and everything be lined up to have the same income, maybe on more desirable hours. And so, Tom, welcome back to Practice Underwater. Just wanted to kind of jump right into our conversation today. So, anything you want to share with our audience before we jump right in?
No, I think you summed all that up pretty good.
Awesome. Well, I have some practice. Um, so I guess if we're going to kind of jump right in, the thing I'm really interested in first is you have 5 operatories right now, and I really want to figure out, like what's going on day in, day out in the office. So kind of walk me through the 5 operatories. How are they used? What's your team size? Just kind of help me understand that.
Sure. So we have two admin at the front, and we
Okay.
have an office manager.
So 3 admin in total.
Yeah, yeah. And two of them are full time, and one of them is their kind of Tuesday, Wednesday, Thursday, and the Friday that we work. So, and then other than that, we have two full-time hygienists, and so one is there um, Tuesday, Wednesday, Thursday, working 10 hours each of those days, and the other one is there Monday to Thursday. So we've kind of been bringing in some temps to cover on, the days that one hygienist is not there on a Monday. So yeah, that's kind of that, and then it's me and two assistants that are there full time with me, and then we do have once a week we have a denturist that comes in. I know that's not a huge thing down in the States, but that was definitely always a desire ever since dental school to have a denturist that we can have here in Canada. So he's there once a week making our dentures for us and stuff and taking care
What
of those needs.
what day is the denturist in the office?
On Thursdays.
Okay. And the denturist takes up an operatory?
Yes, he takes up one of our operatories. So two of the operatories are treatment, two of them are hygiene, and that fifth operatory is kind of like our, sometimes emergency, sometimes the denturist when he's there on Thursdays. So kind of the random op, I guess.
Yeah, makes sense. Okay. So if we're kind of, going to be, okay. So, you're open Fridays 8 to 2, but I don't see any hygienists working on that Friday.
Yeah, so we actually have dental assistants up here can have their scaling module. And so we have an assistant that comes in and does scaling. And then I should have mentioned this. So a lot of our staff are Monday to Thursday. because I kind of added Fridays to try to grow a little bit more. And so then we had to get some temporary, an assistant that comes and does scaling, so mostly on patients that don't have high perio needs, or else and kids, and then I work with one assistant on those days out of kind of out of two ops if we need, but just kind of out of one chair. So
And it's every other Friday?
yeah, yeah,
Okay. And okay. Do you have an admin that comes in on this Friday?
yeah, just one in the front.
Okay. And what's your team's sentiment on these Fridays? Like, does the admin like it? What do the other teams think about it?
I don't think any of the other really likes it because they don't come in because it's the one admin, and so I think she's fine with it because she's the one that doesn't work. No, she's there Tuesday, Wednesday, Thursday, and so I think she's fine to get the odd Friday in there. But we don't have any of our other regular staff, and I don't think they've shown a lot of interest in being able to work Fridays. So
Yeah. So my initial thought is you don't want to work Friday, correct?
no, I don't really like working Fridays.
Yeah. And
If I don't have to.
yeah. And well, you're the boss, right?
Yeah.
So like, it doesn't even seem like it's a productive day. Like you have like half staff. It's half of a small staff. So it's like,
Yeah, not super productive. No.
yeah. So here's my thought. What is stopping us from just saying, denturist, I appreciate you coming on Thursdays. Can you come on Fridays? Keep the admin, the DA, and just get yourself off that schedule.
Yeah, that's a possibility for sure.
Is there anything that you think would make that a difficult thing to execute?
Um, he works out of another office, our denturist, and so it would just be a matter of making sure that that switch would work for him.
Other than that,
Other than that, a lot of times we'll deliver immediate cases, and so we will line up like those to coincide with him working on Thursdays, so he can deliver and do any adjustments that he needs. But I mean that's not a huge deal because we can always insert, and he would see them 24 hours later anyway. So
okay, yeah. So, look, here's my thought. So my thought is, you have an open operatory, right? You're using four, and you have five.
yeah,
So for sure, I want to cut the Friday. Like, I so indications to cut a day. It's not productive, and the owner doesn't like it. Both are met here. Like, there's no reason to
yes,
do
yes,
this. So, like, the strongest recommendation I have, if you do nothing else differently, get rid of this Friday now, because
okay,
and not now, but as soon as is feasible, right? So, like, maybe you go in for a couple more, but like in 6 months, you certainly should not be doing this Friday. Like, there's no reason for you to be doing this Friday.
hmm
Um, so I think that's the first thing. So I hate to just like go so quick over that, but I don't want to belabor a point that doesn't need to be said anymore. Can
right.
we just we want to go 8 to 4 Monday through Thursday? Like, the Friday seems like it's an easy out. So any resistance there?
No,
Okay. No, be done with that. That's ridiculous.
yeah,
Okay.
yeah.
So now let's talk about, I don't want to spend too much time on this, but talk to me about what do you think it would take to go from 8 to 6 to 8 to 4? Do you think that's a hard thing to do, or do you think that's an easy thing to do?
Um,
From an operational, people, scheduling, like all of that stuff.
yes, the only thing that's one of the things I guess I should say that I see being difficult with that is we just hired a hygienist based off of those expanded hours. Like just and so it would be, a little bit at risk of losing that hygienist that we just hired by cutting those hours.
Well, what
But
what hours did you hire this hygienist for? What days and what hours of the week?
Monday to Thursday, 8 to 6.
Oh. And did this particular person come to you and say, I really want to work extended hours?
I think she liked the fact that we had the extended hours because she wanted to get more hours in and have the Friday off.
Got it.
Yeah.
Okay. And is there any way for that hygienist to see patients from 4 to 6 without you there?
Yeah, for sure. The only thing that gets tricky and it'd be good to get your thoughts on this at some point, but just not having a dentist there and having hygiene and not being able to do the exam at the same time. I don't know how much of a holdup that is for practices that do that, but yeah, I mean, there's definitely availability and there's options for that because people like getting cleanings done in the evenings, and so.
Yeah. Um, I think the interesting thing with COVID, and I hope I don't get an angry email from the audience on this, but the interesting thing with COVID is that they've opened up the ability to do exams virtually. So, like for example, uh, like you can have a patient in the office, x-rays can be taken. If something is of a concern, you when the next day when you come in, you can take a look at the x-rays and the intraoral photos or whatever, and like kind of make a diagnosis if you can on those images. It sometimes is challenging, but that's like an option. And the
Okay.
other option is you can just have them like, you can be kind of like on call, so to speak, during those
Mhm.
times. But ideally, you would want more healthy mouths at that window than like somebody coming in. It's been 5 years since they've been to the dentist. They're missing 4 teeth. They have cavities and all the others. Like, you probably don't want that type of patient in the
Right.
office when you're not
Yeah.
there for an initial exam or something like that. So I think that that's something that, it seems like the path of less resistance would be like, for example, let's just say, uh, I'm imagining the last, you have 1 hour hygiene blocks, right?
Yeah, generally, yeah.
So potentially imagine a schedule where you go 8 to 5, you're done at 5. The last thing you do before you go home is you do the exam of those patients that are in from the 5 to 6, and then you walk out. That's something that could be done much more easily, right?
Yeah,
Because
for
you
sure.
don't have to do the schedule differences. You can change your schedule with shorter notice. That might be so. I think that, like, I always try to find um, so like, obviously it's very easy for me to sit on a podcast and be like, oh yeah, do this, do that, do this, do that, but then you actually got to go do those things. And like, it's very easy to get, like, you can get 80% to your goal, and the last 20% is very challenging. And so I would
Hmm.
say that you came and said, so yes, last episode, part one, we were talking about this. You said, I want to work 8 to 4, Monday through Thursday, and every other Friday. And then you're like, well, maybe I don't want to work every other Friday. Maybe no Fridays. And so I feel like from an hours perspective, I think we have a pretty straightforward path to get you Monday through Thursday, 8 to 5:15.
Yeah,
And like, maybe we just go there in like a month,
yeah.
like in short notice, we go there, and then we evaluate the rest later, right? So it's like, let's just get to that spot. Let's see how that feels. Let's see if the 3 day weekend is nice. Let's see how the 5:15 is versus the 6. And then let's iterate on it again moving forward, right? But I think it's maybe much easier to do that intermediate step because you don't have to do anything disruptive to get there, and you're not really costing yourself a whole lot of opportunity in doing that.
Hmm.
And
Yeah.
so I would suggest, hey, how about we do the quick thing, which is, let's in short order get rid of Fridays and have you go 8 to 5, and then check your 5 o'clock patients before you go home, and then you just go home, and everyone else closes up. That would be what I would suggest is like the schedule change that you make in the near term following this conversation.
Sounds great.
Any issues with that?
Not it sounds too easy.
Yeah, well, I'm not trying to get you to grow your practice through extended hours.
Yeah.
So like,
That's
you know,
that's true.
it's just it's at the end of the day, the practice has to serve you, right? Like
Yeah.
that's the point of it, right? So it's like you can do all of these things. There's nothing that is illegal about this. There's nothing difficult. You can make that decision, and however far out your doctor schedule is, like those are the rate limiters. And you go in, you talk to your office manager, you say, look, this is what I want to do. Like, let's do it. And it really if it's hard, then there's a problem. It should not be. This part should be easy. The
Right.
next part is more challenging, which is so if you've noticed, I kicked the denturist out on Fridays. I want the denturist on Fridays, right? Because I mean, you have the admin there. The admin seems to want the hours, so might as well keep the lights on and have that DA coming and scaling people is great, right? Get the denturist in there, and now you've opened up a fifth column. And like this whole time we're talking about like everything I've done so far is shrinking your practice, right? We cut
Yeah.
Fridays, we cut the hour of doctor time. Now I want to do the opposite. I want to start that process that we talked about of prepping and priming for the group. And
Hmm.
so I think we need to have a conversation about clinical productivity because I think that um, I don't know how to not be blunt, so I'm going to be blunt. And I think that you have yet to own what a productive Tom looks like. I think that you maybe think that a productive Tom is a Tom that does many different procedures. And I would argue against that. I would think a productive Tom is somebody who has a very narrow procedure mix and just does everything very efficiently. And so I would actually kind of maybe want to, like, before we get into the scheduling dynamics and what I'm about to say next, I want to first maybe just like get level set with you on like, we're going to grow your top line now. Like, we've done all the cutting and the like the personal life stuff. Now we've resituated that. The next
Hmm.
step of our conversation is okay, how do we grow this practice? And the thing that I want to impart on you is I think growth for you is through efficiency, not through expansion of your clinical box. So maybe we can just, what are your thoughts on that direction? Maybe I'm more in line with your thought process already, but I just don't see like adding implants or like, going and doing like molar endo, like stuff that is, like you don't have that natural um, aggression with clinical growth, but you do have that aggression with like maybe productivity goals. And so I would think like maybe channeling that. This is how I did it. So I'm very similar to you as a dentist. I do not like doing things I'm not comfortable with. And so like I graduated from school, I bought a practice, and I like very quickly shrunk my clinical box because I had some bad clinical outcomes and I just got scared. And I ended up hitting like I was actually fairly productive at my peak. I was very productive. And the way I did it was just like I did crowns, fillings, night guards. And like that I just did them efficiently.
Hmm.
And I see you more in that box than I
Yeah.
do like, yeah, go take the implant course, go buy a cone beam, like get the scanner. Like I just don't see that as your path.
Yeah.
So curious, have you thought about this before? What are your thoughts on clinical productivity? How does this land?
Yeah. I definitely think I align with you more in terms of like procedure mix and with that attitude because I like to feel um very certain that I'm giving my patient, the best opportunity for a good outcome that I can. And so, but I also don't want to get bored. And I'm a
Yeah.
little bored just, doing fillings and crowns. And I really like extractions and I'm interested in implants. And so, but that doesn't mean I have to go and do everything,
Yeah.
and be the super GP and do, apicoectomies and I'm doing this and I'm doing that. I'm happy to kind of stay in my own lane with things that I do enjoy doing and I'm more interested in and referring or bringing somebody else in that can kind of do other things. So,
Yeah, and I'm not saying only do crown and bridge, but what I am saying is only do what you can do efficiently, right? So
yeah,
it's like
right.
your filter for should I take this on or not is can I do this efficiently within my hourly productivity goals? If yes,
Yeah,
proceed. If not, then save yourself the stress.
right.
And so, do you feel like your schedule right now on the doctor side is pretty packed, or where do you feel like is there a bottleneck to your clinical productivity, or do you feel like there's room for you to kind of like maybe get more efficient and do more?
Um, I mean, I always believe I can be more efficient
Nice.
and quicker, and I always think I can improve. Um, we have some struggles sometimes in the staff category where they take a little bit longer to, do a temporary crown because they can make temporary crowns here. Yeah, and so things like that maybe staff wise I feel like slows me down a little bit and that's not say that I am the fastest dentist because I would say I'm very middle of the road. But yeah, uh, having said that, I think there's things that I can improve, but I would say I'm fairly efficient, but my schedule is not packed. And that was my resistance to expanding into a whole nother building and everything like that because I'm doing this and I don't feel like I'm bursting at the seams with my schedule. So
Yeah, so you're heading me. I know exactly where I'm going. So next question: how far booked out are you on the doctor side? So if you wanted to get in a patient for 2 crowns, when could you get them in?
I would say a week at the
Okay,
most.
a
Yeah.
week at the most. And how far booked out are you on hygiene?
Hygiene is more like probably a couple months.
Aha, yes. Okay, so okay, so how familiar are you with our hygiene shtick? I'll call it that.
Not very.
Good. Thank you for being honest. So you talked about wanting to make an investment in your practice. And the area that I would make the investment is the third hygienist. So if I were you, I would bring on a third hygienist into that third operatory that's not being used to see patients. And this is going to accomplish multiple objectives for you. So the first objective it will accomplish is that priming for the group practice, growing your recare pool will allow you to have a faster, quicker, and more fruitful transition into a group practice. Additionally, if I'm trying to juice your productivity, your schedule is not packed and potentially things could be done more efficiently, but you're not bursting at the seams. So, doctor's guide, if you are booked out 2 to 3 weeks back to back, can't get anyone in, super productive, that's where I would say, okay, we're at kind of max capacity at the doctor side. But it appears that there's room for more capacity on the doctor side. So I
Yeah.
would say that that third hygienist is going to be a real essential component to my recommendations moving forward because it accomplishes several objectives. The first is you have the demand for it. You're seeing 40 plus new patients a month, no marketing, and you can't get people in for 2 months. So if you open up more hygiene, there's a lot of signs that show that there will be a lot of candidates to take those openings. Then, additionally, more exams will provide you more opportunities to get things into the doctor side. And then, as you get more efficient, you'll hopefully be able to do more, fit more, and that also aligns with that third hygienist. So, I really think that for you, that third hygienist is going to be a really key piece, and that would be the investment that I would make into your practice is getting a third column of hygiene open and working with your team to fill that up. And then so then the work is twofold. One, you got to get the third hygienist in. The second is you've got to work with your team to become more efficient because now you're checking for 3 hygienists. There's going to be more. You need your team to do more. So that's your growing area, right? You want an area to grow in the practice. It's these systems that need to grow. Your team's clinical delegation, the way that you handle exams, the coordination between hygiene and doctor to make those exams efficient and productive. That's your whole zone of growth right there. So
Hmm.
that's where I would want to push you because what that's going to do is a lot of things. I think you have expressed wanting a higher income. If we get a third hygienist in place and you're doing more on your side, all of that will have a positive impact on your income. And additionally, it will be priming that practice for a group practice. So I feel very, very strongly on this recommendation. So I'm just curious, what are your thoughts?
Yeah, I think that's great. A lot of times I'm hesitant. I'm not hesitant to do that. I'm just, I guess, inexperienced in knowing sometimes how to roll that out.
Yeah.
Like, how, how many days
Oh yeah.
are they full time? And, those are more the questions.
Yeah. And so that's where our expertise comes in. So the way that we do it is we count openings. We have an opening count. But the blanket answer with no help would be 2 days. You open up 2 days, you see what happens in those 2 days, and if they fill, then you open up 2 more. But I have a feeling we need to do kind of um, just a and to somebody who's in our audience for a long time, who's very familiar with our hygiene philosophy. may feel like this is quite redundant, but for you, Tom, I think this is a necessary conversation. So you talked about wanting to invest in your practice. And one thing that, we have like really pioneered at Shared Practices is this whole idea of hygiene, like, the industry in general, dentistry, practice management, focuses on making your hygienist as full as possible so there's no openings. That's like generally what people talk about. And
Hmm.
we take a very counter approach where we say we want there to be hygiene openings. So if the hygiene schedule is not open, and what we mean by open is that you could offer a new patient 3 opportunities in the next week to come in, then like you're not open enough. And so if you think about it, like for you, if we were to calculate it, you would find that there is probably like if a hygienist, how much does a hygienist make per hour in your area?
Um, an experienced hygienist is close to in the 60s, probably an hour.
Oh, geez, yeah, you're on the higher end. And what's your average like like cleaning fee exam, like just the average for one of those appointments? Do you have any idea?
No, I'm not sure. I'd have to look into
That's fine.
that.
It's okay. So, the reality is that, and you would be shocked to think this, but you could have a hygiene schedule that's a third open, and you're probably doing a little better than break even. So you could open up 8 hours in a day, and maybe 3 of them are full, and you would be doing just fine. So, like
Hmm.
this, our philosophy is very odd to people who have just kind of encountered it. But what we've calculated and find, and we have a book called Dental Moneyball that like really explains this in more depth. It really explains that the return on investment, because if you think about it, when a hygiene patient comes in, like you're going to do the cleaning, you're going to get money from that, you're going to do the exam, you're going to get paid for that. You're also going to do the x-rays that are necessary. You're going to get that. Maybe some fluoride or perio are needed. Also going to have an opportunity there. But then you're going to come in, do an exam, and then on average, a certain amount is going to be scheduled on your schedule. And when you calculate all of that, I calculated it for my GP office, and I found that one existing patient appointment was a 9 times return on the cost of a hygienist at $45 an hour. And a new patient appointment was like a 13 times return at a hygienist, $45 an hour for 90 minutes. And so when we did the math on this, we found out that opening up the hygiene schedule and investing in a hygiene salary, like if you were to say, like, I want to make an investment in my practice, I've opened up this expensive fee that I was paying to a consulting company, like I would say the investment should be in the processes, getting your clinical systems and your team organized, and your hygienist. Like that's the investment in your practice. And I think that would be quite a fruitful one, that would much more quickly translate to your income than some of the other stuff.
Yeah. Yeah, I agree. It definitely seems like there's some opportunity there. And I think, I think going back to your question, it's probably about 350 for like a or excuse me, like a follow-up exam and extra bite wings and stuff like that. So,
Wow. So that 9 to 1 that I was talking about, that
mhm.
was at $165 on average.
Oh yeah. Yeah.
So you've got a big return here.
Yeah.
So yeah, I mean, I think to me, it honestly seems pretty straightforward. Like,
Hmm.
I think so, and then like this would free up your life, right? So it's like, imagine you're working Monday through Friday from 8 to 5, seeing patients, being productive. You're checking for 3 hygienists, which will be an adjustment for you, just heads up. But
Yeah.
it's an adjustment that I think is you seem to really like productivity and efficiency. Every time
Yeah.
we've talked on that, you've double clicked on that with your energy, where you've shown me
Hmm.
like, yeah, no, I like that. And you're talking about wanting growth, right? And like that's where I want you to grow. I want you to grow in your productivity. I want you to grow in your efficiency. I want you to grow in the number of people you're seeing every day, the total dollars on your doctor's schedule, but like not in like doing this crazy case that I've never tried before for 4 hours. Like I want you to do things quickly, efficiently, and like, grow with your efficiency. That's where I see your growing edge. And then I think your DAs, like you probably need to work with them a bit on,
Yeah.
like that getting more tight
Hmm.
with the schedule. And then I think your hygienists, like getting that third hygienist and then getting some semblance of co-exam. Like what's your co-diagnosis like with your hygienist when you're going back and forth, Do you feel like they tee up the exams for you where you walk in, patient knows what they need, they're bought in, and I'm just saying yes? Or do you feel like you're doing a lot of that explaining?
I do feel like I'm doing a lot of the explaining, but we now have intraoral cameras in all our ops, which has helped because they take a picture of basically everybody that comes in, and they kind of explain it to them, but code diagnosis in a way of that, I feel like I it's mostly on me. So
Okay. Yeah, I mean, then those are your areas of growth, right?
yeah.
For you, your clinical productivity. For your hygiene team, it's that co-diagnosis working together as a team. And then for your assistants, it's scheduling efficiently and kind of going from there. And frankly, I really think I think we could really help you with all those things, especially the hygienist side. So,
Hmm.
I would think that you kind of fall quite easily into one of our avatars. We call this the patient flow track to a group practice. And what that means is, to get to a group practice where you have two doctors, you need four hygienists that are full time with a full book of patients. And to go from two to four is quite a big transition. And that's where that cut in income comes. But if you, over the next few years, build up that third hygienist to be full, it's going to do a couple of things. One, it's going to very organically grow your practice because you just have 50% more people coming in for hygiene, right? That is just going to lead to more treatment needed, and it's going to make you busier. It's just going to grow your practice kind of on accident. But then it's
Hmm.
also priming that practice to be a group practice where then you say, okay, the third hygienist is packed. We can't get people in for 2 months. Now I'm going to bring on the fourth hygienist and an associate at the same time. And then you can go to a group practice, cut your hours without really even noticing a big drop in your income. And
Yeah.
so, like, that's it kind of, for me, this recommendation feels very holistic in that your personal life, we've addressed it in the getting rid of the Fridays, going 8 to 5. And then you have expressed desire for income and growth. And so I think the desire for income and growth come through adding the third hygienist and getting your clinical systems dialed in.
Yeah. Well, that makes a lot of sense.
Okay, so that's what I got for you. I mean, I don't really have anything else. I think you got to get rid of those Fridays. You should cut back your schedule to 8 to 5, and you should bring on a third hygienist and give that a run. And I really I see very positive things happening for you with those adjustments. So any parting thoughts, questions? Maybe if you're not, you could jump into your takeaway from the episode today.
No, I just appreciate you kind of I think just talking to somebody sometimes just helps get you gain a little more clarity. And I mean, I know you're very experienced at kind of helping people kind of get into the lanes that they need to get into, but I think that is for my stage of life, I think that just makes the most sense is being able to grow because I do want that group practice eventually, and I do like building a practice. You know, it's interesting to me, and I enjoy that. And so yeah, I especially like the 8 to 5 now instead of the 8 to 6, and then cutting those Fridays. Yeah, that I think is gonna just that extra hour every day at the end of my day is I think gonna make a huge difference just even for my family. So
Well, great. Yeah, my takeaway, I've said it multiple times, but no two practice underwaters are the same. And I think that that's what makes them so interesting to people is that Tom's name is not Tom, it's something else. And, like Tom's here, we're having the conversation. And I think the thing that makes Tom's story so unique is the phase of life thing, where it's like, we're kind of like, I don't think I've done that before, where I've kind of told somebody like, maybe a solo for now and a group for later, and it's due to the kids. Like I haven't had that conversation before, and that's just very unique. But I also feel like it really fits where Tom's at in his life and what Tom needs. And so that's what I really like about I think people at times think shared practices is like a very prescriptive philosophy. And what I try to explain to people is we actually try to do the opposite. We try to have this framework that's very malleable, and we try to have the owner guide us with their vision and their desires to using our framework to kind of adapt and model. And I think this was a really unique example of that because we're doing a patient flow track long term, which is normally not a long term avatar. But I think that for this, we might stretch it out for a few years, given where Tom's at with his kids, and then we'll go to a group later. And so, I really appreciated the opportunity to have the conversation, and excited to kind of follow you along and hope that we're part of your journey.
Yeah, no, thanks. I really appreciate you having me on and giving me some guidance. It's been really helpful.